Okay, so we'll get started. Hi, everyone. Welcome to our side event. My name is Keiko Shikako. I'm a professor at McGill University, and I'll be facilitating here with a list of guest honors that we have here today. We have, I just want to go quickly through the technical information that we have here. We do have closed caption available, ASL and ISL. To access those, you just go in the lower bar menu and click on captioning, and the interpreters are in the windows that are pinned. Please enter any information on the chat if you cannot see any of those resources, and we'll try to help. We'll have a question and answers period at the very end. And for that, we ask you to wait, and you can enter questions into the chat during the presentations, and we'll open the mics and cameras then. For the entire duration of the presentations, we ask you to please keep your cameras off and mics off so that we can have the interpreters on the main windows. Also, if you are going to speak, please make your audio description, which I, by the way, will do now. Like, my name is Keiko, as I said. I'm a woman. I have my hair is up. I have a black shirt, and I'm speaking from a blur background. So for all of you, the meeting is going to be recorded. So if you have any issues with that, please also let us know in the chat. And the recording will be available later on. We'll send a link with the recording for all those who have registered. So without further ado, we'll have longer introductions later, but that's all for the technical information for now. So I'll give the floor to Stephen Eastie, who will give us our opening remarks. Thank you.
Thanks, Keiko. Can everyone hear me okay? Yeah. Hi, everybody. My name is Steve Eastie. I live in Halifax on the east coast of Canada. I'm very pleased to be here today. I'm going to do my best to MC this event. The first thing that I need to do is to introduce Minister Qualtrough and ask her to make some opening comments. When I spoke with her office in advance and asked for a biography, I was referred to the website. And I've been in enough meetings with Minister Qualtrough to know that she doesn't really like it when people use that introduction. And probably most people who are on this call have heard it several times before. So I thought instead of that, I just offer a personal reflection and say how delighted I am that Minister Qualtrough is able to join us today, and to say that, you know, it's been quite interesting over the course of the last 6 or 7 years to see the evolution of disability within the government of Canada. It's been particularly interesting in the last couple of years, given the crisis that we found ourselves in. So I think it's a particularly timely discussion we're having today, and I'm really particularly pleased that the minister is able to offer a few opening comments. So with that, let me step back and pass the floor to Minister Qualtrough. Welcome, Minister.
Thank you, Steve. It's so nice to see you, and thank you for not reading out my bio. I'm just so glad to be here speaking to you from my home on the traditional territory of the Tsawwassen and Musqueam First Nations in British Columbia, Canada. So by way of description, I'm in my home office with some books, a file cabinet, and a Canada flag behind me. I have blonde hair and glasses, wearing a gray suit, and I probably look a little tired. But I'm very glad to be here with you all. You know, the pandemic has presented an unprecedented challenge to public health, social support systems, and the world of work. But for persons with disabilities, we know it has only aggravated pre-existing inequalities. I'm cautious about talking about getting back to normal because I believe it's my responsibility as Canada's Minister of Disability Inclusion to help ensure that our future is more equal and more inclusive than our past. We need to do a lot better than our pre-pandemic normal. So, I think that that's a challenge for us all, even in how we talk about what to look forward to. Au cours de notre relance, la Convention relative aux droits des personnes handicapées continuera de guider les efforts du Canada. Nous devons nous assurer que non seulement c'est inclusif à l'égard des personnes en situation de handicap, mais aussi que cela tient compte des difficultés inégales dont a souffert la communauté des personnes en situation de handicap pendant cette pandémie. As you all know, the convention has a preamble containing 25 points, and really 3 of them stand out for me as we talk about how to set policy. First, the importance of recognizing that barriers are the problem that hinder persons with disabilities from full participation and equal participation in society. Second, the principle of what we now call in Canada, nothing without us, that persons with disability need to be involved in decisions that affect us, and that all decisions affect us. And the fact that third, that accessibility is crucial to persons with disabilities being able to enjoy their human rights and fundamental freedoms. Now, these principles have been critical to so much of Canada's progress on disability inclusion. They inform the creation of our landmark Accessible Canada Act, which came into force in 2019. They pushed us to view our pandemic response through a disability lens. And this meant forming a COVID-19 disability advisory group to advise me as minister on the lived experiences of persons with disabilities throughout the pandemic and to inform our federal government's response. And they are really the foundation of Canada's Disability Inclusion Action Plan, a plan that will modernize and revolutionize the way our government supports persons with disabilities. They are the values behind the legislation we will table to create a new Canada Disability Benefit, a guaranteed income supplement that could lift hundreds of thousands of Canadians with disabilities out of poverty. And I know they will push us all around the world to set new commitments, higher standards for the way forward. Now, let me begin with our international efforts and convey greetings from my colleague, the Honourable Harjit Sajjan, Canada's Minister of International Development, who was recently mandated by the Prime Minister to provide greater assistance to people with disabilities in developing countries. Dans le cadre de notre résolution à renforcer le programme inclusif, la promotion et la capacité en faveur de l'inclusion des personnes en situation de handicap dans nos initiatives d'aide internationale, le Canada établit de nouveaux engagements. Ceci implique appuyer les organismes locaux qui travaillent dans la défense des droits des personnes en situation de handicap dans les pays en développement, promouvoir l'inclusion parmi les aides internationales et faire progresser l'inclusion des personnes en situation de handicap dans la prestation de soins rémunérés et non rémunérés. Canada's Feminist International Assistance Policy also helps direct our programming and resources towards aid that is human rights-based and inclusive. At home, Canada advocates for the full inclusion of persons with disabilities in society. At the beginning of the pandemic, we ensured persons with disabilities weren't overlooked and quickly established, as I said, the COVID Disability Advisory Group. The advisory group has been an invaluable source of advice on the real-time lived experiences of persons with disabilities and instrumental in including our needs in our emergency response. The group's mandate has been renewed and expanded to continue to provide advice on disability inclusion and government policy. The pandemic also challenged and stretched Canada's support systems, like it did in many other countries around the world. Significant systemic gaps were revealed, and long overdue conversations on systemic discriminations were brought to the forefront. Last year, we announced Canada's first ever Disability Inclusion Action Plan. Through this plan, we are committed to taking a human rights approach to disability inclusion. Our objectives for this work are to reduce poverty among Canadians with disabilities, contribute to the realization of a barrier-free Canada by 2040, improve access to federal programs and services for persons with disabilities, and ensure that disability inclusion is considered in all government policies, programs, and services, and foster a culture of inclusion and a shift away from attitudes of disableism and discrimination. We'll also create the Canada Disability Benefit, which, if passed by our Parliament, would lift hundreds of thousands of working age Canadians with disabilities out of poverty, and it would be a world first. And finally, we're making investments to ensure Canada has an inclusive early learning and childcare system, which will enable parents and guardians of children with disabilities to participate fully in the economy, knowing that their child is well cared for and that their needs are being met, that these kids are flourishing. Je suis fière de ce que le Canada a fait dans sa réponse à la pandémie. Aussi, je suis inspirée par les efforts incroyables que les communautés canadiennes et celles dans le monde ont fait pour surmonter la pandémie de COVID-19 et soutenir nos populations vulnérables. Le Canada reste un partenaire dans la relance mondiale qui tient compte de l'inclusion des personnes en situation de handicap. Nous sommes impatients d'apprendre des autres pays, des organismes qui supportent les personnes en situation de handicap et de l'approche des Nations Unies fondée sur les droits de la personne qui inclut les personnes en situation de handicap. You know, this event provides an awesome opportunity to do just that, to learn from each other and work together as an international community to to ensure our recovery efforts are broad-based, disability inclusive, and leave no one behind. Thank you so much, Steve.
Thank you, Ministry, for this great opening remarks. It's a pleasure to have you here. Thank you for coming to the event and for outlining those important initiatives that are happening around the CRPD implementation and considering persons with disabilities during these difficult times. Thank you. So we'll pass with that to our next, to our presentations. So the research projects that we'll be discussing or that we'll be presenting here today, there are different parts that were done during the pandemic, and to analyze and understand what are the policies that are being done and how they are responding to the needs of children and families with disabilities, but also of persons with disabilities nationally and internationally. And we also have a presentation from Stats Canada around data that was collected and that is being collected to try to address and to respond to this important and inform these important initiatives that are happening in different fronts in Canada and abroad. So this research outlined the different parts of the research that will be presented. We'll start with Rachel Martins, who is a parent, and she will speak more about herself, but who has participated in many of these projects as a stakeholder engagement strategies and as a partner, really providing the lived experience and the perspectives of families of children with disabilities in Canada. Thank you, Rachel. The floor is yours.
Thank you so much, Keiko. And good morning, everyone. I come to you today from Treaty 7 territory in Calgary, Alberta. And I am a neurodivergent, bereaved parent of a disabled young man. And I come to talk today about the UN CRPD and some of the work that we have done and the experiences of families in Canada. I, much like many other Canadian family, had an intuitive understanding. And next slide, please. There we go. This is my family, by the way. I, much like many other Canadian family, had an intuitive understanding that raising my child was a task that would go somewhat unsupported in many ways. The source of barriers were numerous and the tools for advocacy were few. In connecting with parenting communities, the conversations were always framed within the context of school boards, writing letters to political leaders, and the media. The message brought by parents was often a moral one, which in principle is fine, but deserved a framework based on the CRPD that reflects goals for health and a full life. Goals that any parent strives to support building in their kids. The idea of filing a human rights complaint for many families as a part of their advocacy toolbox was lacking, either because the barriers felt too great for success in filing one, or they were entirely unaware they had the right to seek such help. Next slide, please. The COVID-19 pandemic has offered an opportunity for increased education about the CRPD with families. With a world that struggled with misinformation and disinformation, This offered space to provide clarity and point families in the right direction for support, because often they were the only people talking about those gaps at the time. Where prior to the pandemic, there were cracks in the system, these cracks in many contexts became more like caverns. You will, of course, hear more about the thoughts and feelings of Canadian families and youth in today's dialogue. Disability support organizations, in many respects, tried in the best ways possible to fill in the gaps. However, some could not be remedied, like having support people within the home. In fact, in some cases, particular policies left children and youth at increased risk. From a provincial standpoint, where particular healthcare systems had vaccination mandates, home care for children in some areas saw no such mandate. And so people could find work despite having an increased risk of exposing these children. They could still work with this particular population of high-risk children. So parents had to make a very stressful decision whether or not to have somebody in their home or to go it on their own. I did witness some incredible people come together to bring clarity to heartbreaking situations. Twitter, for example, became a space for people to reach out and connect. And when a young woman who cared for her younger brother who had Down syndrome found herself desperate to be a support, but was denied access to him in the hospital after he was diagnosed with COVID, multiple organizations and Canadian families reached out and helped her advocate for being a support at his side. And thankfully, he's doing a lot better. Next slide. For Canadian families that have been introduced to the concept of the CRPD, it is easy to see they envision it as a framework that could aid in the development of realistic policies that ensure safety, security, health, and a full life across the lifespan for their children. They just aren't seeking the impact in their lives yet at the scale that it deserves to occupy within their lives. Next slide. The emergence of the research world seeking partnerships with DPOs and families has provided a powerhouse collaboration. This has created a surge in progressing policy development that gives me hope to see change where it is so sorely needed. To build back better after a global pandemic requires amplifying the needs of disabled people and children and youth after what has been an incredibly challenging time. Ensuring that the CRPD is at the heart of our efforts is an important thing. I look forward to seeing what we can accomplish together. Thank you so much.
Thank you, Rachel, for this great introduction. It's really important to look forward and see, and I hope that part of this discussion today is really about what we can accomplish together, bringing together civil society organizations, organizations of persons with disabilities, research, government, into conversations that can really help constructing something better as we come out of this pandemic. So I will introduce to you briefly the work that we've done around the WHO and Unicef report on global developmental delays and disabilities, and also then introduce the research that we did around mental health policies. So the WHO UNICEF report was had data collected on children with developmental delays and disabilities around the globe. And we, Dr. Melda Elsebag and team and other researchers, we collaborated to create the report part for Canada. And the objective of this report was really to have data on experiences of caregivers of children with disabilities. To start, it started before the pandemic, but then we added a COVID-19 set of questions to make sure that we would capture this moment that families in all the world was living. It was designed really to enable monitoring of policy recommendations for persons with disabilities, and for that to be used by different international agencies like the UN, the WHO, and UNICEF. And the questionnaire that we used and developed here in Canada was adapted and used also in other countries like Argentina, Iran, Palestine, Serbia, and South Africa. And the other bigger report is also being used by Unicef and actually being presented right now in another side event. So we collected in Canada a survey for 883 caregivers responded to our survey. As you can see here, the majority of participants were in the autism spectrum disorder and had intellectual disabilities, anxiety, and other conditions related to development. And that's according to the responses that the caregivers provided. The family income, as you can see here in the distribution, majority, so we had about a third of participants on the 60 to 80 thousand Canadian dollars a year. Most kids were distributed between 57% were male, and families had a working status of working full-time. Half of the families were working full-time. And kids were, half of the kids on average were 6 to 12 years old, representing school-age children here in Canada. We asked the families about specific points, for example, in terms of information during the pandemic, if they had received enough information, services, and supports in the different areas for their child. And the responses were very alarming in a sense that the vast majority of families had received none or some, but not enough information about financial help and technology available for them while they were doing homeschool with the kids during the periods of lockdown. They also had not received enough information about educational plans for school at home and other aspects of education service, mental health services, and physical health services for their child during the time of the pandemic. So information sharing was an issue that was concerning and that was voiced by families in the survey. This was also, we also looked into predictors of resilience during the pandemic, and we saw that the intrinsic factors that were associated, that we know from research that is associated with resilience, are younger age and the type of disability. And we saw that also caregiver self-efficacy and access to school are important predictors of resilience. From the sample, we saw that aspects related to the caregiver mental health were very important. So both for the child and for the caregiver, sleep disturbances, which were very prevalent during the pandemic, mental health issues, increased repetitive behaviors and decreased social interactions were some of the factors that contribute to a perception of possible developing more resilience, but also having consequences for mental health. And that combined with the lack of access to services is something that we need to look at closely and to assess how we can then now restore services and make sure that those families are being attended to. There was a big team involved in this research and would like to thank them all for collecting the data and doing different parts of the analysis. The other project that we'll then briefly speak about is the Nothing Without Us project. This was a project funded by the Canadian Institutes of Health Research with the support of all these organizations that you see listed below. Dr. Jennifer Zwicker and myself were the principal investigators, and with a great team of researchers. I will speak about the first part, and Ash Seth will talk later about the other part of this project. We had also a big team of associates, graduate students, co-investigators, and a lot of consultation with civil society organizations and other community organizations that helped us inform and were advising throughout the entire process of the project. This project, we are on the premise that children with disabilities and there are issues with intersectionality, right? So we know that children are also girls. They also have intersecting low income families and other areas that need attention and that could, by definition, be deprived or be marginalized, especially during a time of crisis like the pandemic. Mental health is an essential type of service during and post-pandemic, and one that we will need to pay more attention to as we establish new recovery services. The fact that the UN CRPD is a framework that can really help developing policies and programs that are equitable and they're comprehensive, that really address different areas that we need to pay attention and cannot forget. And we used also as a framework the Bridge the Gap indicators developed by the Office of the High Commissioner in Human Rights as an opportunity to understand aspects related to the structure, the process, and the outcomes related to the implementation and monitoring of the CRPD. This project then used based on the definition from the UN or the warning or the concern that we must guarantee the equal rights of people with disabilities to access healthcare and life-saving procedures during the pandemic, the urge to place people with disabilities at the center of COVID-19 response and recovery efforts, and to consult and engage people with disabilities throughout the process. The World Health Organization has also established specific considerations for persons with disabilities during the COVID-19 outbreak, highlighting that certain populations, such as those with disabilities, may be impacted more significantly by the COVID-19, and this impact could be mitigated by protective actions and actions taken by key stakeholders. So this project, we wanted to identify which were the COVID-19 related policies that were supporting the mental health of youth with disabilities and their families during the pandemic, and then co-design recommendations for COVID-19 policy responses that include those concepts of inclusiveness, equitable, and or also evidence-informed to mitigate other harms and promote well-being. Considerations for mental health that were particularly important for children with disabilities and their families during COVID was the social isolation that was sometimes prolonged for children who could not easily return to school or to community activities while vaccines are being figured out, where public health measures limited the participation in the community in general. Also then decreased access to physical education or physical activity in general, and leisure and other free play activities, and that has a strong impact on mental health and development. Also the increased screen time and sleep disruptions that could have occurred during this time, and increased rates of depressive and anxiety symptoms that we saw in other phenomena in other emergencies in the past, and decreased access to supports and services overall. The first objective of this project was then identify the mental health policies in the different Canadian provinces and territories, and verify how they aligned with the UN CRPD indicators. This alignment, we would then hope to cross with the information that was collected from families to see what are the gaps and how we could inform those. We collected data on policies from June 2020 to June 2021, policies focusing on mental health and with a focus also on children and families. All official documents published by provincial governments were included, and those included guidelines, services, and resources descriptions, and anything that was relevant to youth 0 to 24 and their families. We used a text mining methodology to using the cross-industry standard process for data mining, where essentially we did a text mining analysis of all the corpus, all the documents that were collected, and trying to identify within these documents which were the articles of the CRPD that were related, that were mentioned through the words and keywords generated. Also through a mental health model that we created using mental health symptoms as stressors, attitudinal and environmental aspects related to mental health. And then we also did a content analysis, doing a close read of these documents, looking to policy levers, key implementation considerations, and other aspects that were identified by families in the other objective that Ash will talk about in a minute. So to give you a quick overview, we used all the CRPD articles and the indicators for structure, process, and outcomes as outlined by the UNOHCHR. And we created then a dictionary that was able to capture all the different aspects of the CRPD in the text of the policies that we collected. So briefly, the results that we obtained, we had a total of 362 policy documents that were collected across the provinces and territories. We identified some alignment with the UN CRPD indicators, and especially in relation to Article 24 of the CRPD, that is about education, Article 11, that is about situations of risk and humanitarian emergencies, and Article 19, which is about living independently. This graph that I'm showing gives a quick overview of the frequency of this article. So how much of the text that we identified in the policy documents related to each one of those articles. So as you can see here, a lot on education, a lot on situations of risk and emergency, and some distribution in relation to the other aspects of the CRPD, like habilitation and rehabilitation, family, work, children, participation in cultural life, and other articles that you can see. So to give you a quick overview of how each article was addressed, an example for Article 24, there were guidelines, for example, that was from the Manitoba government about revising existing policy and develop new inclusive education policy to ensure compliance with existing constitutional and provincial human rights legislation. That's what you see in the first square. And I won't read all the different extracts, but the articles that related to the education article on the CRPD, they were especially about adapting existing programs to respond to the needs that children had now. So adapting existing special education programs and creating new ones like tele-rehab and other options so that children could access education even during the pandemic. In terms of Article 11, examples were that one extract provided. So students with special needs and students at risk would require additional supports, as well as consistent and more frequent collaboration and planning, strong communication across different sectors and support teams. This would ensure decision-making, the most inclusive learning environments possible and cohesive approach to learning and to belonging to school community. And that was captured specifically in articles talking still about education, but in the context of emergency responses, how to adapt the existing programs to make sure that they responded to the needs of kids during the time of the pandemic. Article 26, there were plans about adaptation of individualized plans, rehabilitation offered through different means that were not provided before, and making sure the parents and caregivers were supported and had the necessary equipment, the necessary training that was needed to provide the follow-up, or at least the minimal continuation of services during the pandemic time. In relation to mental health, most of the policies that were analyzed had issues about aspects about symptoms and outcomes and about the stressors that families could potentially be perceiving during this time. But there were not a lot of concrete plans because we didn't look into the program levels, but not specific actions toward mental health supports in some provinces, but not very evident in the majority of the documents that were analyzed. The policy focus and the supports and services that policies aims to provide, the implementation mechanisms and the common thread of policies across provinces is what we analyzed closely in the content analysis. We identified that policies focus especially on public health, which is important. The considerations during the emergency responses, what should be thought of for children with disabilities during this time, also to guarantee service continuation, so both in education and health, not so much continuation on community services, but that's also was disrupted for everybody. And there were also lots of policy documents discussing aspects related to funding opportunities. Some of the implementation mechanisms that we identified were about service continuation and restructuring. We saw that telehealth was a priority for children with disabilities, and developing those services in the provinces was important and was prevalent in a lot of documents. Also, small exemptions like email instead of in-person submissions for service requests was something that was mentioned in a few different provinces, provincial documents. Services usually provided in school to be provided at home. So a lot of children with disabilities receive health and other supports at school, and there were provisions for the services to be continued at home in different mechanisms for that. Considerations for public health measures included exemptions to mask wearing, for example, in Alberta, access to family members to children who cannot communicate during hospitalization in different provinces, and financial supports were provided both for the individual, so equipment to support distance learning, and also to organizations through allocations that were usually allocated for regular services to be able to be reallocated to respond to the special needs of children with disabilities. So Ash will now give an overview of the second objective, and I would like to thank all the families who have participated in all these research projects. And so Ash Seth is a research associate at the University of Calgary, and he will speak on the interviews on the parts that were done with the families. Thank you.
Thank you, Kiko, for the warm welcome. I'm Ash Seth. I'm a male, and I'm wearing a white shirt and a blue blazer on it. I wear glasses, and I'm in my home office in Calgary, which has a white theme on the walls. I would also like to introduce Genevieve Curry, who is a co-researcher in the study Objective 2 and our shadow presenter. Genevieve is wearing glasses. She's a female, and she has golden hair. Welcome, Genevieve. Okay, slides, please. Okay, slide 2. Next slide, please. Our objective 2 of this study was aimed at determining the experiences of youth with disabilities and their families accessing services and their mental health needs during the COVID-19 pandemic. This study also seeks to inform policymakers and decision makers about how policies could be better designed to match the needs of families and youth during emergencies. To accomplish our objectives, we began our journey by defining our cohorts of interest. Cohort 1 were parents and caregivers of youth aged 0 to 30 years with neurodevelopmental disabilities. Cohort 2 were youth with neurodevelopmental disabilities aged 18 to 30 years inclusively. This study utilized a mixed methods approach where we collected and analyzed both qualitative and quantitative data. As a first step, interested parents and youth completed an online screening survey, which asked questions about their demographic information and disability. Subsequently, interviews were conducted in English and French from February to August 2021. Participants varied as per demographic factors such as income, location, disability diagnosis, community size, and indigenous status. For phase 1 of the study, we recruited parents and caregivers of youth from a previous study done by our team. We conducted semi-structured qualitative interviews with 40 parents and caregivers to understand the impact of COVID-19 policies on them and their children. The interviews involved open-ended questions and probes on access to services, education, employment, and mental health needs, resulting in a dialogue-based conversation between researchers and research participants. The second phase of the study captured the experiences of youth who were recruited through various social media platforms like Facebook and Instagram. Youth who met the participation criteria had a choice to either participate in a detailed online survey or semi-structured Zoom or telephonic interviews. This choice in the interview approaches were adopted to strengthen inclusivity in participation. Overall, 40 youth across Canada participated in the study, and interview questions were identical to those asked to the parents. Finally, interviews from both cohorts were transcribed word by word and analyzed in NVivo, a data analysis software that helped researchers generate key thematic areas. Rigor and confidence in the research were established by seeking input from the project's advisory council and multidisciplinary research team at different stages. We have also shared the study findings with the parent cohort and have invited their input to understand if the findings resonate with them. Next slide, please. The results from our interview enabled us to understand how the pandemic impacted youth with disabilities and their families. First, we will discuss the results of parent and caregiver cohort. Overall, we found that parents, caregivers, and their families experienced disruptions, delays, and denials during the COVID-19 pandemic. we found that the service disruptions negatively affected parents' ability to access services and supports for their children. For example, we heard from many families that service disruptions were most prevalent in children's schooling, therapies, and counseling. Concerning delays, we heard from parents that they experienced longer than expected wait times and delays in seeking healthcare services, such as general physicians, referral appointments, and surgeries. Regarding denials, we heard that many families were denied access to visit their loved ones in hospitals and group homes. Parents of young children mentioned that their children were denied access to recreational spaces and much needed educational support services in schools. Some parents faced denials in receiving flexible accommodations at their workplaces and had to reduce their work capacity for caretaking purposes. Next slide, please. Such interruptions in access to services profoundly impacted families. For instance, parents were worried about their children's mental health and development. They reported an increase in their children's social anxiety and regression in academic development progress compared to pre-pandemic levels. Families also felt the financial strain due to changes in their employment status and increased cost of accessing special supplies, such as personal protective equipment and dietary supplies for their children. The impacts were also experienced in the caregiving capacity of families. Many families mentioned that they experienced competing demands of caretaking, managing children's online schooling, and work from home. Lack of respites and supports further compromised the caregiving capacity of families. The negative impacts of disruptions and delays also resulted in the unbalancing of family unit. It brought along unexpected changes in the daily routine of parents and their children, along with the loss of social connections. Next slide, please. As mentioned earlier, we also interviewed youth with neurodevelopmental disabilities, in addition to parents and caregivers. We are still analyzing these results, but thought we would provide you a snapshot of preliminary results. To begin, many youth face disruptions and delays in accessing therapeutic and other services, such as mental health counseling and support groups. For education, youth mentioned that they were concerned about their academic scores and success. Young students also highlighted reduced opportunities for accessing well-being services such as student counseling and wellness services in their educational institutions. Regarding employment, many employed youth reported job losses and a reduction in working hours, which affected their financial well-being. Some youth also mentioned inadequate professional development opportunities as they transition from post-secondary institutes into the labor market. Concerning stressors that impacted mental health, many youth reported the loss of social connections and faced challenges in meeting friends and family because of their compromised immunity. In addition, the fear of catching infection outside their home and staying at hospitals without loved ones significantly impacted their mental health. Consequently, these stressors resulted in various mental health symptoms like increased anxiety and panic attacks. Some youth faced more isolation as compared to pre-pandemic levels. Disturbances in sleep patterns and overall functioning were also reported. Next slide, please. As I conclude my talk, may I take this opportunity to share some firsthand experiences from parents and youth in the study. A parent mentioned, "My son has complex needs. He needs therapy and social skills programs. He pretty much lost all of the services for about the first 6 months of the pandemic. He was just dropped as if life does not exist." A youth mentioned that, "I was without people for a good 5 months. It really took a toll. I've got autism, so normally socializing is a thing or not a thing. But this time I really need to be social. I'd sit at home all day, watch TV, and do nothing for hours. and my sleep schedule just got messed up. It got to the point where I wasn't really functioning properly. Next slide, please. We are confident that the findings from the study will provide critical insights for disability-inclusive recovery policies and programs that integrate the needs of youth and their families for their safe re-entry into the society. On this occasion of Global Disability Summit, we trust that evidence-based findings from our project and many other similar research studies will facilitate the full implementation of rights of persons with disabilities in the situations of risk and humanitarian emergencies. Final slide, please. We thank our research team and advisory council for their hard work and guidance toward this project. I appreciate your attention and hope you enjoy the rest of the event.
Thank you, Ash. And so we'll continue our presentations with Professor Matthew Hunt from McGill University, who will present the results of another research project using the CRPD as a framework for COVID-19 policy responses analysis.
Thank you so much, Keiko. Yes, my name is Matthew Hunt. I'm a professor with Keiko at McGill University. I'm a man. I am at my office in Montreal. I have a painting of a tree behind me. I have a gray jacket on and a white shirt and an increasingly white beard. And I'm so pleased to join the conversation today and to be able to present this work on behalf of our research team. This project takes a wider lens than some of the projects described thus far, in that we are asking a question at the international level, comparing the COVID-19 policies of different countries in relation to the CRPD, looking at these policies through the lens of the CRPD. Next slide, please. Keiko already shared the quotation that is on this slide, which comes from the World Health Organization. It is one of the starting points for this research project, which began in the spring of 2020. The World Health Organization, the United Nations, and other international bodies were issuing recommendations to countries, identifying the needs to be responsive in their policymaking in terms of the differential impact that COVID-19 would have on groups within their populations, amongst their citizens, and in particular for people with disabilities. And I've highlighted this sentence. Speaking about this differential impact, it says, this impact can be mitigated if protective actions are taken by key stakeholders. And an important element of that, or a precursor for the protective actions, we could say, would be the development of policies that address these questions, identifying priorities and measures. That's not the most important step. The question of implementation will follow, but it's a beginning place. And that's really the objective and motivation of the project, was to assess alignment between policies and international commitments for disability rights. Next slide, please. So we have this international scope. I want to emphasize that the methods for this project are very similar to what Keiko described for the analysis in relation to mental health and Canadian provinces and territories. Here, we're not focused on mental health, we're focused more broadly, and we're looking at it at a global level. We started with the idea that we would focus on countries that were had ratified the CRPD, so that they had made these commitments internationally. And then for pragmatic reasons, we selected countries that had English or French as one of the national languages. And we aimed to select countries that had varied income levels and were from different regions of the world. So we ended up with 14 countries that we chose. They are represented, there's a photo on the slide of a globe with pins indicating countries. I will just name the countries that were in our analysis: Canada, India, Australia, France, South Africa, Jamaica, Fiji, the Philippines, Zimbabwe, Rwanda, Haiti, Malawi, Ireland, and Guinea. And of course, we would have loved to include more countries or include all countries, but we made some practical, pragmatic decisions in making these selections. Hopefully it's illustrative of some of the policy, the landscape globally. Next slide, please. So because we're thinking about different countries, we need to emphasize the different realities. We are in a global pandemic. Countries have experienced that in different ways. There's a graphic on the screen that shows a one-year timeline and waves of cases of COVID-19 for the 14 countries. The main message is that we see different points and peaks for these different waves. They are of different shapes and length. And we see that in corresponding to the policymaking. So countries made policies in response to what was happening both internationally and at the national level. Next slide, please. This is an even more busy graphic on the screen, and it shows something called the Stringency Index. And so there was an effort to try and evaluate on a scale from 0 to 100 the stringency of public health measures. It shows this for the 14 countries and changes over time. The important message here again is that countries enacted different types of public health responses. So closing schools or workplaces or limiting travel. So these are important aspects that differentiate between countries. Next slide, please. Now we'll focus in on the specific countries in the specific policies that these countries have enacted. We collected data. We started in July of 2020 and continued into June of 2021. We also collected data that had already, or documents that had already been issued by countries before that time. So about a third of the policies were policies already in place in July of 2020. And they total 764 policies across the 14 countries. Next slide, please. Here on this graphic, it breaks that down by month and by country. There's a wide variety in terms of the absolute numbers of policies. Some countries like Canada and India, France, Ireland, the Philippines issued more policies, and others, very few policies like Guinea and Haiti. I have highlighted 5 countries that are distinctive because they actually issued policies that were specific to disability. So most policies are general policies, but Australia, Canada, France, India, and South Africa collectively issued 31 policies focused on disability. Next slide, please. Now, if you will, I'm going to start peeling back layers of an onion in terms of our analysis, where we start more superficially and then become more and more precise with our view towards assessing disability rights as they can be represented through policies. So our first layer of analysis was just looking at what are the phrases that appear commonly in these texts. And this is reported here on this slide. We see commonly issues that you would expect: vaccines, public health, healthcare, physical distancing. And we looked at combinations of ideas. I will just highlight 2 things that were interesting. One is that the only health condition that appears prominently here is mental health. And then when we looked at populations around topics, the population in terms of age groups that was focused on most in policies were children and youth. Next slide, please. Now, we did a similar thing to what Keiko described with the Canadian subnational policies, as we looked at the frequency with which we saw correspondence with different articles under the CRPD. And we see similar things emerge. You will not be surprised that Article 11, which focuses on risks and emergencies, is most common. But interestingly, Article 23 around families is almost as frequent, which is different than the Canadian data at the subnational level. So at this national, international comparison, we see more focus on family, and then followed by education and living independently. Next slide, please. What's an interesting comparison to make is if we just look at those those policies that were specifically focused on disability. So these came from 5 countries, as I mentioned before. What we see as an interesting change is that in these disability-focused policies, living independently and community living that article becomes more prominent and in fact appears more often than Article 11 on risk and emergency. So an interesting trend to observe. Next slide, please. We then identified specific instances within these policy documents to try and look at, well, yes, we see these alignments or these correspondence with specific aspects of the policies. How can we pull out specific aspects? How does it speak to disability? So one of the things that we see commonly, there are some examples here from India and Malawi, are sort of general indications of needs and vulnerability specific to people with disabilities. Rarely do we see specific examples of concrete actions, more just a recognition and not necessarily tied with a concrete action. Next slide, please. Article 19, which we saw became the most common article when we looked at the disability-specific articles. It's interesting to see that actually the focus here is very much on accessibility and accommodation. These are two examples from Canadian policies. On the left is a policy excerpt which speaks to accessibility of hand washing facilities for people with disabilities. And on the right is an excerpt which speaks to accommodation and access for testing facilities for COVID-19. So showing some of the specific ways in which Article 19 is reflected in the text. Next slide, please. So just to pull together, I think this initial step of identifying what exists within policies sort of opens up some lines for further reflection. We see questions. Obviously, the next question is, what is the implementation of policies? What we don't see either is what resources or budgets are put aside to these questions, but it opens up questions about the role of governance and different structures, questions about participation in policymaking. We only saw 2 countries that spoke specifically about advisory entities in the policymaking process. And then how the CRPD and other international frameworks get integrated in national level policymaking. And the final slide, please. I want to finish with just thank you to all those who participated in this work, especially to our advisors who are listed on the screen, but also to the funders who made the research possible. And thank you all for your attention.
Thank you so much, Matthew. We will have now our last presentation of today, done by Rubab Arim from Statistics Canada. She is the Chief Social Analysis and Modeling Division, Analytical Studies, Methodology, and Statistical Infrastructure field at StatsCan. And it's a pleasure to have you sharing with us today, Rubab. Sorry,
Keiko, you can keep the slides. I'm okay. And if I can just get your help, because I can. It's all, yeah, no, sure. Not a problem. It will help. And thank you very much for helping with my description as well. So here I am. I'm a woman. My name is Rubab Arim. I work at Statistics Canada, and I do wear a pink and then with a white turtleneck top. And my background is blue, and I do have a very busy logo, basically saying my branch name, which is Analytical Studies and Modeling Branch, both in English and French. And today I'm truly very happy to be here. And I too also would like to acknowledge that I reside in Ottawa. Both my home and my office are located in Ottawa, unceded territory of the Algonquin and Anishinaabe Nation. And so I think with that, we can go to the next slide. Thank you, Keiko. So certainly COVID-19 was a very difficult period for all of us. And as Statistics Canada, we continued to provide high quality information to inform decision-making, to support decision-making. So really the COVID-19 pandemic was an opportunity for us to shine, to make sure that all the information needs were met. I'd like to quickly go over what we achieved during the pandemic. So we started actually 2 new data collection series during the COVID-19 pandemic, namely Canadian Perspective Studies series, which focused on impacts of COVID-19, resuming social and economic activities. So really to understand the economic and social impacts of the COVID-19 pandemic. The second data collection series was on impacts of COVID-19 on Canadians, a data collection series that focused on different social topics, such as parenting during the pandemic, such as those of us who are living with long-term conditions and disabilities, how the pandemic impacted those people. And these were actually in addition to other data sources that many of us are familiar at Statistics Canada on child and youth health and disabilities, such as Canadian Health Survey on Children and Youth, which is a survey conducted for our children between 1 and 17 years. Canadian Community Health Survey, which is another survey conducted with our population aged 12 years and older, and then Canadian Survey on Disability. And I'd like to here highlight that our census 2021 has been successfully completed. The first results have been released for those of you who are actually looking at our LinkedIn. And so the census is actually providing our sampling frame for the Canadian Survey on Disability. So we are really happy and proud of those achievements. Next slide, please. So what I would like to do in the next couple of slides is just to provide some snapshots from some of the findings that we found during the pandemic. Very early on, between March 29 and April 3rd, we conducted our first panel survey, Canadian Perspective Survey Series. More than 4,600 people answered from the 10 provinces of Canada, and about 22% of these respondents were youth aged 15 to 30 years, so youth. And 40% of them reported excellent or very good mental health. So data is actually really making sense when it puts in a context. So what did really this 40% mean? Next slide, please. So here on this slide, I am showing a figure with the y-axis basically showing percentage of Canadians and the x-axis showing different age groups. And for each age group, I have two different bars, dark blue bars showing some data from the Canadian Community Health Survey in 2018, so pre-pandemic time. And the light blue bars, which would be the findings from the Canadian Perspective Survey Series. In a nutshell, when we compared the blue bars, the light blue bars with the dark blue bars, we can see that those 15 to 24 years certainly reported less excellent or very good mental health. You can see that the light blue bar is significantly lower than the dark blue bar. And we do not see a similar effect for the seniors age group, for example, for those 65 years and over. This is what I'm trying to say when I said, put the data in the context so that we can provide further insights, better insights, and probably actionable insights. So this graph right there basically shows that one of the vulnerable groups during the pandemic was certainly our youth. Next slide, please. Turning to the other survey, the impacts of COVID survey, we looked at the challenges of the families of children with disabilities who were especially vulnerable to the impacts of COVID-19 pandemic as well. And again, on this slide, I'm showing another figure with the x-axis showing percentage of parents, and then the, y-axis showing the percentage of the parents, and the x-axis showing the different domains of concerns. For example, physical health, mental health, loneliness or isolation, school year and academic success, amount of screen time, online safety, eating junk food or sweets, for example. And in a nutshell, I'd like to say that a higher proportion of parents of children with disabilities were very or extremely concerned about their children's amount of screen time, loneliness or isolation, general mental health, school year and academic success when we compare them to parents of children without disabilities. Next slide, please. So the data and the stories behind those data are very important for us. And for this, Statistics Canada recently started a podcast series. The first episode focused on talking about the barriers, not the disability, activity limitations, and COVID-19. And the second episode focused on unraveling impacts of COVID-19 on Canadian families, including those with children with disabilities. Next slide, please. So one question, why is this important? Why telling the data story matters? For a simple answer, better data for better decision-making. It is important to gather timely information, to understand experiences, to assess the needs, to raise awareness, and to inform policy and suitable support measures. Leaving no one behind, it is that principle exactly, and building back more inclusive. Minister Qualtrough actually highlighted some of these support measures for us as well. So I'd like to build on a little bit more on those by highlighting what Statistics Canada would like to do moving forward. We would like to focus on our enhancing our engagement and communication with our key partners and stakeholders. We would like to increase our data integration and increase access to those to provide more actionable insights. We would like to continue to increase our data services so that we can inform decision-making. And finally, we would like to do all of these by ensuring transparency as well as protecting privacy and confidentiality of our respondents. Next slide, please. On this slide, I'd like to share some of the latest news on surveys and statistical programs. And the first one, again, was mentioned by Minister Qualtrough as well. It is the Canada-wide early learning and childcare to address information needs to ensure an inclusive and accessible early learning and childcare for children with disabilities in Canada. At Statistics Canada, with our key partners and stakeholders, we are at the moment developing a survey for children, for childcare specifically, among children with disabilities. A second initiative that I would like to highlight is our disaggregated data action plan to produce detailed statistical information to highlight the experiences of specific population groups, including people living with disabilities, and track progress toward a more fair and inclusive society. And finally, the system of national quality of life statistics that aims to provide comprehensive and usable evidence on interrelated factors such as education, such as employment, life satisfaction that result in high quality of life, equality, as well as sustainable outcomes. So these are just some of the examples that we would like to move forward in the upcoming years. Next slide, please. I would like to thank you for all your information. And on this very busy slide, I'm showing a logo of my branch, but also our StatScan mobile application, which is now available for you to download to be able to hear more about our recent findings and latest news coming from Statistics Canada. And finally, la présentation est aussi offerte en français. Pour en obtenir une copie, veuillez communiquer avec moi, s'il vous plaît. Merci beaucoup and bonne journée. Thank you very much and have a great day.
Thank you so much, Rubab, for this presentation. A lot of information for us to grasp and discuss. I'm very pleased that we are on time with our event, which so I will ask the speakers to turn on their cameras and Steve to come back on the cameras. And if that becomes disruptive for the interpreters, please let us know in the chat and we'll try to alternate. But let's see if that works. I will not share the PowerPoint anymore so that we have everybody back in. So Steve, I will invite you to bring us all to the discussions. period.
Okay, can you hear me? Yeah, great, thank you. I don't know about others, but I feel like I've absorbed pretty much as is humanly possible in 75 minutes. It's a fascinating bunch of presentations. I think we've got about 15 minutes or so for questions. So if folks have questions, I'm not sure, Kiko, how you'd like to do this. People use the hand raising feature and either bring their camera on and ask a question or put it in the chat box. Does that seem okay?
Yes, I think, yeah.
Okay, let's give that a try. And while people are getting familiar with that, I'd like to start by asking Matthew a question. Matthew, I was really quite fascinated by your presentation. Thank you. I was curious to know, when maybe you said this and I missed it, but when Minister Qualtrough was speaking about the Canadian response, she talked quite a lot about the National Advisory Committee that they put together here in Canada. And I didn't notice any reference to a similar structure in other countries. Are you aware of similar approach was used in any of the other countries that you studied?
Excellent question, Stephen. Thank you. And I did mention just in passing that there were 2 countries that we had identified a consultative committee. It wasn't specific though. One of those was Canada. The second was France. So those were the 2. And I should clarify that that's where within the policy document, there is a reference to such a body or such a consultation process. It's not to say that they don't exist in other contexts. They might be, they just weren't discussed in the policies themselves as we were able to identify them. But it's a really important question, as we know, even within the CRPD, a process and having aspects related to participation and consultation are expectations within the CRPD. And so it's an important question to ask using that lens of the policies as they are formulated.
Yeah, it's absolutely true. You know, I mean, Article 4.3 of the convention talks about that in a very specific way, and it's proven to be a key in terms of implementation of the convention. In any case, I don't mean to dominate the discussion here. Would somebody else like to ask a question? Not all at once, please.
Would encourage people to either raise their hand or to you can turn on your cameras. I see a question in the chat. That's a very long. So I'll try. Do you want to read it, Steve?
Kiko, I'm sorry, but I can't find it. I got too much happening on my screen with the captioning and stuff.
Okay, so I will read it. Okay, the question on the chat. So the person is that is identifying a big barrier that there's so I'll read if that's okay. So I have worked hard to rehabilitate some serious physical disabilities, and now I'm fully ready, willing and able to work in a full-time job that will support me. This has been my biggest barrier. I can't seem to jump this hurdle, and it's not from a lack of trying. I'm receiving only offers for part-time with no benefit packages. My prescription expenses are significant, and I need to eat and healthy diet in order to be able to work. I cannot stay on the system I'm on. I need to work for my own sense of self-worth. What do I do? Very important question. Thank you. Addressing work and barriers to access work. And
can I jump in on that? You say that, I mean, it's really interesting. And I think it's quite true for a lot of people with disabilities that they wind up patching together jobs here and there. I mean, I've certainly gone through periods of that myself over the years. But I am involved with an initiative that responds to the Canadian government's promise for a Canadian disability benefit. And I think that, this kind of circumstance, this kind of situation that the Canadian Disability Benefit really speaks to. And it's something that, as someone who's been involved in disability work for a long time, I've been quite amazed to watch. Minister Qualtrough talked about the Canadian Disability Benefit and said, I think rightly, that if the government of Canada does enact the disability benefit, it will be a world first. I hope it's not a world last at all, but I think that, it really responds to the whole range of economic, social, and cultural rights as articulated in the convention. And I think that, as a disability community and as researchers, it's probably the key policy point for us over the next 2 or 3 years to see that thing through. And I think that if we do that, then we'll see a significant difference in the lives of not just the questioner, but many tens of thousands of people with disabilities across the country. Other questions?
I see another question from Neil in the chat. How effective is international work with the UN CRPD in changing disability policy in Canada? As a non-binding agreement? Excellent question, Neil. Thank you. I'll let you start, or anyone can jump at it. But Steve, you want to start?
Not really, no. Neil is making trouble for me. I would say, I'm not on the panel here. I'm just some schmuck trying to get people to answer questions, okay? But having said that, I think that what we see over time, Neil and others, is that while things like the CRPD or the Convention on the Rights of the Child, or CEDA, are non-binding, as you say, that what they have the effect of doing is changing in a lot of ways the nature of the discourse and dialogue. And if you reframe things and start to look at them in a human rights kind of a way, I think a lot of people find that a sort of esoteric notion, to say, well, we're going to adopt a human rights framework and things. But over time, if you look at the situation of women in society, or of kids in society, or racialized people in society, with the adoption of a human rights framework, when you start talking about that, I think gradually over time, it doesn't happen on a Tuesday afternoon or a long weekend in March, but over time, you see a real change in the way people understand the rights of a particular group. So while I wouldn't dispute that there are problems with non-binding mechanisms, I think that the larger point is that they really help society reframe their understanding of issues. Anybody else care to make a response to that?
Perhaps I could just add a thought to that. I think part of what we're seeing here today in the research projects and through the different initiatives done by Stats Canada that Rubab also presented is that there is more awareness, right, by the fact that we know when we are using the convention in different ways. I think there are opportunities, for research to develop data on indicators for Statistics Canada and other national data collection mechanisms to pay attention to this population and to collect the segregated data as recommended, and then to use this data to inform policy, to use this data to inform advocacy efforts from the different groups in society. So I think this is an advance of having the recognition and the obligation, even if non-binding, of using the convention in practical ways in the different sectors. So yeah, definitely builds up on the work. While we're waiting for if other people want to speak, but I think it was very hopeful to see what Rubab presented on the next initiatives on the current and upcoming surveys, one of the responses from the UN CRPD committee to Canada was the lack of data on different populations, and a lot of that has been addressed through the new instrument. So I think this is it shows progress, concrete, and then the next step is for sure to see that translated into policies. Anyone else wants to comment on that?
There is a question from mail.
Go, I see Neil has asked a second and now third question. Boy, enthusiastic fellow. The second question talks about the CRPD being entrenched in a Canadian law like UN CRPD, and asked if we see that as likely. My honest response is, Neil, no, I don't really see it as likely. I wish it were, but I'm not sure that I see it happening in terms of a carte blanche adoption of the CRPD. But what you do find, I think, over time is that you develop case law which makes reference to this convention or other conventions. So while you don't have a wholesale adoption of a UN convention like the CRPD or the CRC in the same way we've seen with UN CRPD, I think that you do see it manifests in the kind of day-to-day legal workings of provinces and the federal government. Anybody else have a comment about that?
I will say I can't speak from the technical side of things when it comes to law, but I can say in terms of knowledge, the
I see a
pandemic.
question about any data collected upon racialized people with disabilities. I'd be quite curious about that myself. Anybody will speak to it?
Yes, Rubab will.
Eva, I'll take that. Thanks, Keiko. So first of all, I'd like to thank the participant for this very important question. So as I mentioned, the Disaggregated Data Action Plan is actually focusing on disaggregating data by racialized people, by persons with disabilities, by gender, as well as by Indigenous identity as well. And all the other intersectional analysis are right now our focus. At the moment, I can't recognize any published paper at the moment, even though please don't quote me on that. If you could email me after this presentation, I'll certainly check to confirm that we haven't published anything yet, but I can definitely confirm there will be statistics that will be published, especially after the Canadian Survey on Disability that will go in the field very soon. That's right, exactly. Specifically racialized persons with disability, exactly. So it's actually a combination of those two disaggregation. So if you could email me, I will quickly check our website to see if anything has been published during the pandemic, because I know on racialized people, we certainly published in terms of their economic difficulties, but the intersection between persons with disabilities and racialized people, I do not remember. But I'd like to check and confirm.
Thank you, Rubab. This is great. We can put the slides back to, and just before we.
Thanks. I see Kiko sent a note saying that Rachel wants to speak. I just want to comment. It's a bit like being on Hollywood Squares, trying to be, on this panel, watching all of these people, plus captioning and the chat box. So I'm very dizzy now, and I'm looking forward to the end of this panel. With that, Rachel, let me give you the floor.
No worries, Steve. I'm always happy to listen to you talk anytime. I'm always a fan. When it comes to the legal side, as to what we were talking about before, I mean, as a person, just live as I hate to say ordinary citizen, I feel very pessimistic, but at the same time, I think the pandemic has offered an opportunity for knowledge that has never been afforded to Canadians previously, to have larger conversations about that. I have taken an opportunity, for example, to do so just because this sort of an education has never been afforded to families in any context whatsoever, other than, and this comes from a personal interest in misinformation and disinformation, is that some of the bigger topics came up, were brought out of context about COVID, but they could be shifted back into context for families. And that provided a really interesting opportunity for conversations. And I do hope that there are more to come.
Thank you, Rachel. So I was trying to wait for the caption to roll. So thank you very much for all the points. I know that there were some questions that may have been lost in the chat. It started to roll really fast, but just a few technical follow-ups. So we will be sending for all of those who registered. Well, everybody had to register. So we have your emails. We'll send you the link for the presentation, and in the presentation we'll have all the email contacts for the different presenters if you want to follow up and have more information on specific presentations. And I would like to, before giving Steve, that's the heads up for the wording for you to finish up for our closing remarks, but just before that, I want to thank you a lot, the technical team behind this event today. Roberta Cardozo, Mernouche Movahed, and Alex Zerbo. They really did a lot of work in lining up everything so that everything runs smoothly today. Really, really thank you so much, the three of you, for all the support and work. We hope that this has been a good, fruitful discussion. It is unfortunate that indeed Steve, Zoom is not the best platform for chatting and discussion. We really wish we could all be having coffee now and eating cookies and something, and that would be a much better conversation for sure. But that's what we have for now. And so thank you for everyone for staying with us. I'll give to Steve for our closing remarks.
Just very quickly to say, Kiko, thank you to you and your team. I have to say that this is one of many, many such Zoom calls I've been on, like all of us, over the past couple of years. The background preparation work that went into today's event was really quite overwhelmingly impressive, and I think it's paid off. So thanks to you and your team, and to the presenters, and for those of you who've actually managed to stay with us for these long 90 minutes. I hope that you have a good rest of the day. Thanks. Farewell, everyone.